crazy amounts, yes, fluoride
Yeah.
is toxic. They will show you online that it's used in rat poisons and
Yes.
different things like that.
Yes.
But in the amounts that come in the toothpaste tube, in the children's toothpaste tube, the little bit you're putting on the toothbrush not only will not harm your child, it's going to be so beneficial to your child. It's been shown to reduce decay so significantly. It's the biggest public health aid there is the fluoridation in all the forms that we get it.
Why are your primary teeth, which are your first set of teeth, why are they important? I get this all the time.
Dr. Leedia, that's the best question.
They're going to fall out anyway.
Why do you even have to check these teeth?
Why are
do
you
I
in
have
business?
to come?
Why do I have to
Exactly.
come to you?
That is, we get that all the time. So the reason is, it's for a lot of things. It's when I go to speak to kids groups, I ask them, I said, why do you need your teeth, And my answers are, A, you want to smile. You want to have a beautiful smile. You don't have a mouth full of missing teeth, broken teeth, decayed teeth. There's nothing worse than that. You need it to eat properly. You need it for your nutrition. So if a child is having problems with the teeth, having tooth pain in the mouth, it affects the eating, it affects the nutrition, and that affects your entire body. So you need it to smile, you need it to eat, you need it to speak. This is when children are learning how to speak and their speech is coming along. If you're missing teeth, it causes all kinds of problems with your speech as well too. So there's so many things that are involved in that. Now beneath the baby teeth, the permanent teeth are growing. So if a baby tooth gets affected by decay or we have to remove a tooth early, it affects the permanent tooth that's growing underneath it too. So, and these are the teeth that are going to be for a lifetime. So by not caring for the baby teeth, you're causing harm potentially to the permanent teeth. And you want to make sure that everything is growing where it should be to make sure that the permanent teeth will be coming in. You have proper spacing, you have the right amount of teeth. There's such a thing as having extra teeth we look for. There's such a thing as being missing teeth. And all of these things affect also your growth and development in the child and for a lifetime. So it's very important to go and take care of your baby teeth. Absolutely. Not that it's not important. Why is it important? It's very important.
And I think it's so ironic that this is so important, yet it remains to be the most chronic disease in children.
Decay is considered the disease in children, the most prevalent disease. And it's mostly preventable and treatable. So that's why it's got to be checked and followed up with the dentist.
Tell me a little bit about ECC, early childhood caries. What causes it, and what do you tell parents when you see this in your chair?
So when I first start seeing the parents with a 6-month to a 12-month-old, one of the most important things that we talk about is this ECC called early childhood caries, which is otherwise known as baby bottle syndrome or milk bottle syndrome. And there are kids who go to sleep at night with a bottle of milk, a bottle of juice, a bottle of soda.
That hurts.
Yes,
soda?
Soda. I've seen that too.
Okay.
And they're laying in the crib. The problem is they're laying in the crib holding on to this bottle. And the tongue is sitting up against the roof of the mouth and holding the nipple of the bottle in their mouth. So this sweetened liquid and milk loaded with sugar. Natural milk loaded with sugar. Mother's milk loaded with sugar. Juice loaded with sugar. And soda, I don't even want to talk about.
Sorry to interrupt, but breast milk has sugar, right?
Breast milk has sugar.
Has sugar,
yes.
yeah. So, a lot of moms think that.
No, it's the same thing. I have moms where the child stays latched on all night long. That's the problem. So my point is, anything that you're going to give them in a bottle, they can have before they go to sleep. They drink it, you swallow it, and it's not staying around the teeth. It's the best is to brush their teeth afterwards, obviously, or wash it out with water, or do something, but you can. But not to lay there in the crib all night long with a bottle in your mouth, or to stay latched on all night long. Because what that does is all of the sweetened liquid allows the bacteria in the mouth to cause decay. So what we see is children with their upper 4 front teeth completely broken down, back teeth broken down, and they need fillings on their teeth, they need caps on their teeth, they need root canals on their teeth.
And that's really traumatic.
It's a whole procedure, and we're doing this on kids 2 to 3 to 4 years old. So then to treat kids at this age, We have to deal with sedation and having anesthesiologists. It's a whole procedure. So it's involved, it's expensive, and it's a whole to-do that's easy enough to prevent. Just don't do it. Don't do it. And I've had parents who have gone through this with me, and it's traumatic mostly for the parents. More than the parents than even the kids, because the kids,
they forget.
They go through it and they have their sedation. But they have multiple children, and I say, how's this one? No bottle for this one. No bottle for. I learned my lesson. I'm not doing this again.
Yeah.
And it's expensive as well too. It's a lot of treatment.
What about, doctor, she doesn't fall asleep without her bottle.
For those who go crazy and really need the bottle that much, I say just put plain water.
Water. Okay.
So keep watering it down till it's just plain water. And one of two things happens then. Either they'll drink the water or they go, I'm not interested in this, and they throw the bottle out, and that's the end of the story. But water won't cause it. So it's really, the early childhood caries, the milk bottle is really from sweetened liquid up against the teeth throughout the night, and that's what's causing it. So when you stop that sweetened liquid, and water doesn't have the sugar in it, it's not going to happen.
How do you feel about pacifiers? For them to give them the pacifiers instead of the bottle, which is obviously much better for their teeth, to give the
So the pacifiers are not going to cause decay.
Okay, no.
Except for those people, believe it or not, who dip the pacifier into honey and give it to them. I've seen that as well too. I'm not advocating that, So
I haven't heard of that one.
You haven't heard that?
No.
Okay, Doctor, you
I'm learning
you practice
something
as long as I do. You've just about seen it all.
Okay.
But there is such a thing.